It's a self-empowering place to be because when we go get traditional medical help, we're relying on the physician to heal us. In integrative medicine, we rely on ourselves to heal ourselves. So it's not one or the other, it's integrative. We use physicians for their expertise, and then we learn how to take care of ourselves. And I like to say that self-care is primary care.
Integrative medicine is not just treating diseases as they happen. It's really looking at the whole person, or in our case in pediatrics, the whole child. The other thing I would say about integrative medicine that's unique is that it's very patient-centered. So in our case, that's about the kids and the families, and we try to meet them where they are at. It's very individualized, and so it's not a one-size-fits-all philosophy. We listen to our patients, we spend a lot of time developing that relationship, and so it's also very relationship-centered. In fact, the relationship in integrative medicine is one of the most profoundly healing aspects of the practice.
When I think of integrative medicine, I think of treating the entire person. That's, of course, physical symptoms, but we really can't differentiate between that and what's going on in the person's mind and heart and in the rest of their life. So an integrative medicine approach uses all researched and substantiated modalities to bring back balance and wellness into someone's life.
We're integrating the medicine into what they already are getting as their care. It's not leaving or isolating their doctor that they already have. It's adding to and thinking that there's much more to healing than just taking a pill. There's much more that you can do and have ownership of your own health, and therefore be empowered by if you think of integrative medicine.
We bring basic brain health, including nutrition, exercise, mindfulness, and sleep hygiene. Those four are basic to any condition, not only mental health. So we try to incorporate those, and then of course there are other modalities that we integrate, like yoga, acupuncture, music, art therapy. The more we use those natural remedies, the less medications and less complications we have to use.
Try it on and see if it fits, and to be willing and open to the possibilities that it provides, the healing that it provides.
It's not that complicated. We're complicating life too much. It's simple. It's reconnecting with nature and with the community.
One of the beautiful things about integrative health and integrative community is this idea of building community, that we're all working together. This is not a top-down patriarchal system where you have the doctors and nurses and everybody following from that. We're all working together seamlessly. So if you're a yoga instructor or you're a yoga student and you're learning about health from that perspective, that's a very different paradigm. We're really encouraging people to work together in teams so that a healthcare team could be made up of a number of different people, but that would include things like yoga or nutrition, just as importantly as the medical care piece. That's the new kind of healthcare system that we're trying to build, and we need to do that together.
I just am really excited that the medical practice in general is taking more of a change to look at everything in a patient as the whole patient, because there's, instead of just the disease, how can they prevent these things from happening? And if they do have a problem, what is the root cause of the problem, as opposed to just treating the symptoms?